Have you ever really thought about it? I mean, what keeps your heart beating, your lungs breathing, your stomach digesting, all without you even thinking about it? It's like your body has this incredible internal autopilot running the show 24/7. Well, today, we're going to dive into what that system is, and even better, how we've learned to hack it. So what is it? What's this master control system that's constantly making all these life or death decisions for you, whether you're fast asleep or, running for your life?
Well, here's the answer. It's called the Autonomic Nervous System, or the ANS for short. Now I know this diagram looks pretty complicated, but the core idea is simple. It's a constant tug of war. You see these signals coming from the top and bottom of the spinal cord? That's one team. And they're always competing with signals from the middle section, the other team. These two forces are in a constant, delicate dance to keep you in balance.
So let's properly meet these two opposing forces. They're like the yin and yang of your body, the two drivers who are always running the show right behind the scenes.
Okay, on one side you've got the parasympathetic system. The easy way to remember this one is rest and digest. This is your chill-out mode. It slows your heart, gets your digestion going, basically it handles all the quiet, housekeeping stuff. And on the other side, the famous fight-or-flight response. That's your sympathetic system. It gets you ready for intense action by jacking up your heart rate and shutting down anything that's not essential right now, like digestion.
So let's start with your body's factory default setting, that calming rest and digest state. This is where you are, hopefully, most of the time.
The way it sends its calming messages is with a key chemical messenger called acetylcholine, or ACH. You can just think of ACH as the molecule that goes around telling all your organs, hey, take it easy, slow down, conserve some energy. Honestly, the easiest way to think about it is this. If your body is a car, the parasympathetic system is the brake pedal. It's what keeps you from redlining all the time and makes sure everything runs smoothly. All right, time to switch gears to the other side of this balancing act. Let's talk about the sympathetic system. This is your body's internal alarm bell. It's powerful call to action when things get real.
And the fuel for this system? A chemical called noradrenaline, or NA. This is the stuff that floods your body when you're stressed, scared, or even super excited. It's the signal that screams, get ready for action right now.
So, if rest and digest is the brake, I think you know where this is going. Fight or flight is, you guessed it, the gas pedal. It floors it, flooding your body with resources so you can accelerate and face whatever's coming.
Okay, a brake pedal and a gas pedal. Now this is where medicine gets really cool, because once we understood this whole push and pull dynamic, we figured out how to actually hack the system. We can design drugs that press either one of those pedals for us. The first way we can do that is with something called an agonist. So think of your body's receptors as little locks. An agonist is basically a drug that's shaped like a master key. It fits the lock perfectly, turns it, and activates the system, just like the body's own natural key would.
And then you've got the exact opposite, an antagonist. This drug is also like a key that fits the lock, but instead of turning it, it just gets in there and breaks off, jamming the keyhole. It blocks the body's natural key from getting in, effectively shutting that system down. So let's look at some really powerful, real-world examples of hacking that fight-or-flight system. To slam on the gas pedal, we use agonists like adrenaline in life-or-death situations, like when someone's heart stops. And to block that same gas pedal, we use antagonists called beta blockers to treat things like high blood pressure or even to calm the physical jitters of performance anxiety. You see, by either boosting or blocking these systems, pharmacology is all about restoring balance when our internal autopilot goes a little haywire. Let's check out a few more incredible examples of this in action. Okay, now this is super interesting because it explains why different drugs have such different side effects. It comes down to this. Some drugs are lipid-soluble. That just means they can sneak past the super protective blood-brain barrier and start messing with your central nervous system. But others are water-soluble, so they can't get in. Their effects are stuck in the rest of the body. And knowing that difference, it's absolutely crucial in medicine. This kind of precise control allows for some seriously clever medical diagnostics. Take the test for myasthenia gravis, which is a muscle weakness disease. Doctors give a drug that temporarily boosts that rest and digest signal. If the patient's muscle strength suddenly improves, boom, diagnosis confirmed. But if their weakness gets worse, well, that tells the doctors the person actually had too much stimulation to begin with, a totally different problem. How smart is that?
And this balance is no joke. Here's what happens when it goes to dangerous extremes.
On the left, you see poisoning from organophosphates, stuff found in pesticides. It causes a massive overstimulation of the rest and digest system. Think pinpoint pupils and a dangerously slow heart. Now look at the right. That's poisoning from something like the belladonna plant. And it does the exact opposite. It blocks the system completely, leading to a bone-dry mouth, a racing heart, and delirium. It's a perfect picture of two opposite crises.
But of course, blocking these systems has some incredible therapeutic uses. Let's go back to those beta blockers, the ones that block the gas pedal. Look at this list. They're used for everything from high blood pressure and migraines to glaucoma, and famously, to help musicians or public speakers manage their anxiety by calming down the physical symptoms of stress.
And on the flip side, you've got the ultimate gas pedal booster, adrenaline. This is the go-to drug for anaphylactic shock. That's a severe allergic reaction where a person's blood pressure just plummets and their airways start to close up. Adrenaline powerfully reverses all of that. It is a literal lifesaver.
But here's a fascinating wrinkle. It's not always so straightforward. A drug like adrenaline can actually have opposite effects depending on how much you give. At a low dose, it can sometimes lower blood pressure. But at a high dose, it hits different receptors and causes blood pressure to absolutely skyrocket. It's a perfect example of just how complex this whole balancing act really is.
And that right there brings us to the single most important point of this entire explainer. It all comes down to balance. By truly understanding this endless tug of war between our body's gas pedal and brake pedal, we've gained this incredible power to step in and fix the imbalances that are at the heart of so many diseases.
I mean, it's a powerful concept that has already changed millions and millions of lives. And it just leaves us with this final, fascinating question to think about. As our ability to hack this system gets even more precise and sophisticated, what new treatments and possibilities are waiting for us just over the horizon?